Now I would like to turn it over to today's speaker, Shannon Sweeney-Jorgensen.
Good morning, everyone. As Keely mentioned, my name is Shannon Sweeney-Jorgensen, and I am one of the founding members of an organization called Northland Healthy Minds. It's a collaborative of over 50 Northland businesses, organizations, and individuals focused on the elimination of stigma around mental illness in our region, and we're based out of Duluth, Minnesota. Before we begin, in the interest of full disclosure, I have to admit a few things to you. First, I'm not a mental health professional or expert. I'm quite simply someone who cares very deeply about this topic. I will share some important statistics with you shortly, but one of the things you need to know is that mental illness is everywhere, and everyone on this line has been impacted by it, whether you know it or not. It could be that you have an employee or coworker who is struggling with the mental illness, and they are afraid to tell you. It could be that you have a loved one who is fighting to get out of bed each morning because of depression, and they don't want to tell anyone because they will be seen as lazy. It could be that you are like me, and your very best friend in the world wasn't able to tell you that she was struggling, and she killed herself. Or you could be like me and be fighting your own battle with depression, anxiety, and PTSD. Today we're going to do two things. We're going to discuss stigma and its impacts a bit, including some excerpts from a great free resource called the Make It Okay campaign. And we're going to talk a bit about Northland Healthy Minds, an organization that's trying to tackle stigma. Now, before we go any further, we are going to have a few little sections where I'm going to hope for some audience participation. So feel free to, in the chat portion, just enter in your answer to some of these questions. Does anyone know what stigma is or have any examples?
And if people want to talk, please remember just to press *2 to unmute your line.
No examples? When you think about somebody with a mental illness, what do they look like? How do the media and entertainment industries portray it, and what slang terminology do we use? This isn't the time to be politically correct, but let's really think about it and be honest about, what things are we thinking about when we talk about mental illness. Very often we hear words like lazy or disheveled. We use slang terminology like psycho, schizo. There's many different examples of stigma and how we talk about mental illness. Now, what I want you to do is also think about what slang terminology or kinds of words do we use to describe someone with a broken leg, or someone with diabetes or cancer. Very often we think in terms of strength and bravery and courage. I really dream and hope for a world someday where we talk about people with mental illnesses in those same kinds of terms. By definition, stigma is a set of negative beliefs that a society has about something. Stigma of mental illnesses includes the negative ways we think about what someone looks like, the words we use when we talk about them, and it is any kind of a negative mindset and provides no value to society in general. Ultimately, it boils down to discrimination, leaving people who have mental illness or those who are caregivers to feel that they are not as valued and are perceived as a burden or even dangerous. And we're not here to point fingers or place blame on anyone. Rather, we're here to use this time as an opportunity to reflect on how mental illnesses have been negatively portrayed, and then really make a pact to do the best we can to change our language, our thoughts, and our attitudes moving forward. So what I want to do is do a quick stigma check of ourselves. Now, I'm not asking anyone to out themselves, but I just want you to think about these next 3 slides from your perspective and really honestly look at what your feelings are about them. So we're going to check our own stigma. I would be reluctant to seek help if I had a mental illness. And just think about whether or not you agree or disagree with that statement. I would see myself as weak if I had a mental illness and could not fix it myself. And lastly, I am more comfortable helping a person who has a physical illness than I am helping a person who has a mental illness. Now, again, the reason that I bring these questions up is not because I want to point fingers or want us to blame anything, but we do need to acknowledge that each of us comes to our lives and to every situation that we enter with our own level of stigma and our own level of experience with mental illness. So why is that important? Well, a person experiencing a mental illness lives with their symptoms for an average of 10 years before seeking help. Fear, shame, mistrust, and misinformation are factors in delaying care, and the impact of waiting to seek treatment can include a loss of employment and income, and sometimes jail time, or even the worst, suicide. The highest dropout rates are among youth with a mental illness. People with an untreated mental illness end up in our criminal justice system, and last year more than 700 people died by suicide here in Minnesota. Some other facts that may shock you, or maybe not, but they should at least concern you. 1 in 5 adults will experience a mental illness, and for some frame of reference, only 1 in 8 has diabetes. Serious mental illness costs America $193.2 billion in lost earnings per year. Mood disorders, including major depression, dysthymic disorder, and bipolar disorder, are the 3rd most common cause of hospitalization in the U.S. for both youth and adults aged 18 to 44. Depression is the leading cause of disability worldwide, according to the World Health Organization. Individuals living with serious mental illness face an increased risk of having chronic medical conditions, and adults in the U.S. living with serious mental illness die on average 25 years earlier than others, largely due to treatable medical conditions. Suicide is the 10th leading cause of death in the U.S., the 3rd leading cause of death for people aged 10 to 24, and the 2nd leading cause of death for people aged 15 to 24. And each day, an estimated 18 to 22 veterans die by suicide. And again, people wait an average of 10 years before seeking treatment. And when we really think about that and think about the idea of waiting 10 years to treat your diabetes or treat your cancer, the kind of devastation that that would have on your life is incredible. And yet, people with serious mental illnesses wait 10 years before seeking treatment. Here in the Northland, in the Duluth area, in the Arrowhead region of Minnesota, we're lucky to have some data available from a survey called the Bridge to Health Survey. The Bridge to Health Survey has been an important source of data on the health status of adults in northeastern Minnesota and Douglas County, Wisconsin for nearly 2 decades. The survey was first conducted in 1995 and every 5 years since then. And I just want to go through some of the important information that we found out from that survey. And what we're seeing is that this information is being duplicated or replicated across the country. We are seeing these same kind of statistics coming out of surveys and research that's being done. So overall, in northeastern Minnesota, residents report having anxiety or panic attacks, about 23% of respondents. About 25% of respondents indicated having depression. And we found that residents who live in poverty were much more likely to report stress, depression, or problems with emotions for 14 or more days during the past month compared to residents who are not in poverty. So clearly, economic factors impact people's mental status and their mental health. Additionally, that poverty status causes people to be more likely to delay seeking mental health care compared to residents who are not in poverty, and that has to do with barriers to access. Unfortunately, that's not something that I'm going to be able to solve or address, but it's something that we need to be aware of, is that the access is important. In that same Bridge to Health survey in 2015, people reported their reasons for not seeking or delaying mental health care was that they did not think it was serious enough, or they were too nervous or afraid. And those 2 items are directly linked to stigma. Stigma causes us to think that, our concerns are not important enough to risk being labeled or being treated differently by people. And being too nervous or afraid, very often that's fear of that stigma, fear of being labeled or being discriminated against. And lastly, in the northeastern region, this is just a chart that really displays how many people failed to get or delayed seeking mental health care by county. And again, these are staggering numbers. 16.7% of the respondents in St. Louis County failed to get or delayed seeking mental health care. And again, that's largely due to stigma and due to those top two reasons that were on the previous slide. So, as I said, we're going to talk a little bit more about mental illness and about stigma, but one of the things I want you to think about also is really how common it is. Mental illness is as common as silver cars, and when you get in your car today and head home, you'll be amazed at how many silver cars you're going to see on the road. It really does put that into some real perspective for you as to how common mental illness really is. A public survey recently showed that most people thought mental illnesses were related to stress, lack of willpower, and weakness. And really, that is what stigma is all about. It's really, truly recognizing that mental illness is a medical condition, and it should be treated with the same dignity and respect that any other medical condition is treated as it's not a moral failing, it's not a character flaw, it is a medical condition. So what did we do about it, or what can we do about it? In 2012, through a partnership between Health Partners and NAMI, the Make It Okay campaign was launched. Health Partners, of course, is a health insurance company, but they also own some healthcare facilities, and they had realized through a variety of avenues, from some culture surveys with their employees and health needs assessments, as well as through their health risk assessments and some community surveys, they realized that they had a serious issue within their own employee organization. The healthcare professionals who had some serious stigma going on, and it was affecting the quality of care in those facilities. So they decided they had to do something about it, and Make It Okay became their tool to start tackling that issue. I was first introduced to the Make It Okay campaign in March of 2017. I was invited to a mental health symposium in the Twin Cities where John Moe was the keynote speaker. Not sure if anyone on the call is familiar with him, but he's a humorist who works for NPR. He hosted a couple of shows for them. One, I believe, was called Wits. And not too long ago, he was asked by his producer to pitch a new show. Now, he was scrambling to come up with something, and under pressure, his brilliant idea was to pitch The Hilarious World of Depression. He thought there was no way it would fly, but ultimately they loved the idea, and he now has a wildly successful podcast series. I highly recommend you check it out. Again, it's called The Hilarious World of Depression. But at the time in March 2017, that podcast series was just getting off the ground, and he was the keynote speaker at this event that I was had in the Twin Cities. As I sat in the audience, he told a very touching, engaging, funny story about his life and his personal struggles with depression and the loss of his brother to suicide. He was so completely relatable. And as I sat there listening and laughing with tears streaming down my face, I realized he was telling my story. I realized how not alone I was, and that somehow there had to be a way to share that feeling, to truly make people feel less alone. So that day I drove home and listened to The Hilarious World of Depression the whole way, and alternately was, laughing through my tears and crying through laughter, because he really sits down and gets engaged with comedians talking about mental illnesses. Again, I highly recommend the series. It's fantastic. And while I was driving, I decided that there had to be something I could do. And fortunately for me, it was very fortunate for me, there was. At the time, I was the Employee Benefits Administrator for the City of Duluth, and I decided that in May of 2017, I would launch Make It Okay for our employees. So I went back to Duluth, and in the month of May, I gave about 20 Make It Okay presentations at different work sites with city employees. It was easy. The presentation is already there on their website. I had no training. I had no big plans other than that I wanted to get people talking and hopefully make them feel less alone. The presentation includes some of the first slides that we went through today, the self-check for stigma and some of the facts and figures, but it also really spells out how easy it is to start the conversation. These things aren't hard. And what I discovered in doing these presentations was that I didn't need a medical degree or a master's degree to start these conversations, and they did have an impact. We noticed an immediate increase in the number of personal interactions people had right there at the presentation about things they were dealing with themselves or with family members. Conversations that had not been happening the week before. People were talking to each other. We also noticed an uptick in our EAP, our Employee Assistance Program, utilization. If you're familiar with EAP programs, typically you can expect to see about a 6% utilization rate, and the City of Duluth was no different in that. We saw a 6% utilization rate for our EAP. That's it's not great, but it's normal. It's typical. What we saw immediately following the Make It Okay campaign was that our utilization rate on our EAP went from 6% to 16% utilization in 1 month, and it stayed there. And to me, that was a huge success because it meant that people were reaching out and getting assistance. They were self-identifying and asking for the help they needed. So what next? Well, health partners heard about what we were doing in Duluth and saw the success that we were having with the program, and they asked me to host a meeting in June of 2017 to discuss with some other organizations the implementation of Make It Okay. That was really the birth of what was to become Northland Healthy Minds. A few organizations were represented at that first meeting. I think we had maybe attendance of 12. Today we have over 50 organizations that are regular attendees and are involved. And a few weeks ago we had we started a strategic planning process to figure out where we go from here and how to expand our efforts. And really that strategic planning process has started in probably June with the intent of figuring out how we become more sustainable. We started out with very modest goals a little over a year ago. We wanted about 15 employers to present Make It Okay within their organizations. That was it. No grand plans, no big splash, just simple implementations at employers to help us learn and talk about mental illness to help make it okay. We really were focused on employers because we thought if we had multiple employers in our region implementing the same program, hopefully people who worked at, families who worked at two different organizations would be getting the same message at work and then come home to their dinner table and talk about it, and there would be additional, ripple effect type experiences because of hearing the information, getting the same message at work, and then normalizing the conversation at home. In our early work, we used just 3 key messages. Those key messages were, it's okay to have a mental illness. Many people do. It's okay to talk about mental illness. Talking makes us feel less alone. And it's okay to get help with mental illness. Life can get better. And when we started off a little over a year ago, those were the key messages, the only guiding principles that we really had. And we used that to get us off the ground. Just within the last couple of months, we've developed our mission and vision. Our mission being that Northland Healthy Minds is a collaborative of businesses, organizations, and people in northeastern Minnesota and Douglas County, Wisconsin, working together to eliminate the stigma surrounding mental illness through community outreach and education so that all those affected by mental illness know how to seek support and resources without the barriers created by stigma. And then our vision is that Northland Healthy Minds envisions a world where anyone can get the support and assistance they deserve for their mental illness without fear of discrimination, marginalization, and criminalization due to stigma. And really it all just comes down to treating other people as human beings and recognizing their dignity as human beings. So some of the things that we did throughout the year, and we really were gearing up for a big splash in Mental Health Awareness Month of May of 2018. We did a number of events in that month to help promote mental health awareness, and they included a proclamation by Duluth, Superior, and St. Louis County, along with several other municipalities in the region, recognizing May as Mental Health Awareness Month. We had, as I mentioned, modest goals. We wanted 15 organizations to implement Make It Okay campaign for their employees. And in fact, when all was said and done, we had 36 organizations participate, and we reached over 26,000 employees. We hosted Fidgety Fairy Tales in 2 local schools, which is a great program that brings mental illness to life in an entertaining and understandable way for elementary school students. It features children portraying some of those familiar fairy tales with a twist. So, for instance, Little Miss Muffet, I think she has an anxiety disorder, and the Three Billy Goats Gruff deals with ADHD. We hosted laughter yoga in Leif Erikson Park, where 50 people came together, strangers, and spent an hour laughing hysterically and walked away feeling really positive and good. We hosted a session with Community Action Duluth, which is an area organization that serves marginalized and economically challenged families. We did a session with them regarding the connection between tobacco usage and mental illness. We presented a free screening and facilitated a discussion of Suicide: The Ripple Effect at a local theater. Suicide: The Ripple Effect is a fantastic documentary. It's about Kevin Hines, who is the gentleman who jumped from the Golden Gate Bridge and he lived. And he now is a speaker and an advocate for mental health awareness and for really breaking down stigma. One of the really powerful things about that film is he talks about his trip from the edge of the bridge out to the center of the bridge. And if you haven't been to the Golden Gate Bridge, it is definitely a destination, and people walk across the bridge every day or run across it, and tourists visit it and make that trek. And as he was walking from the edge of the bridge out to the middle to make his jump, he had sort of an inner monologue going on in his head, and he kept thinking to himself as he passed each person, on his way out there, please just look at me, smile at me, ask me how I'm doing, just looking for some acknowledgement of his humanity, and that might have made all the difference in the world to him. And that's really what breaking down stigma comes down to, is just the idea that we want to treat people with dignity and can respect and recognize their humanity. And that's really the basis for all of this work. We also hosted a free community dinner and mental health resource fair at one of our local high schools. The Students Catering Club prepared the meal. We served 400 people a free dinner. They had access to mental health resources right there at this resource fair. And then John Moe was our keynote speaker that night. So it was sort of a full circle moment for me. But what was really interesting about that was that because it was set in a high school, the meal was being served cafeteria style, and strangers wound up sitting together at these big cafeteria tables. And again, conversations started happening because there was this safe space. Complete strangers were talking to each other about their experiences with mental illness and how it had impacted their lives. And some of the feedback that we got from the exhibitors, the people doing the tabling at this event, was that it was unlike any health fair they had ever been to, that people were engaged, that rather than, people sneaking up to the table and quickly grabbing the swag, the pens and the goodies on the table and running away, people stopped and talked and asked questions and were really, truly engaged in the discussion about mental illness. Again, we served 400 free meals that night. We also had about just under 400 people that stayed and listened to John Moe speak. And it really was a phenomenal event of community and of awareness and of breaking down that stigma. A few things that came up along the way for us. When we started out, of course, because we were looking at, we were looking at implementing with employers, we were dealing with a lot of HR directors. And the HR folks were saying, okay, we'll talk about mental illness, but what if my employees start talking and I don't know where to send them? So they were worried about HIPAA, they were worried about all kinds of other issues and about where to send people. And so one of the things that we wanted to do was make sure that they had resources at their fingertips. So we created a resource card, and this is actually both sides of the card. The top half is just some information about our organization, and that was on one side of the card. And then on the other side of the card was a list of local mental health care resources, and in particularly crisis resources. We have these cards available at every single event we did. They're small, they're sized small enough so that you can stick them in your wallet or stick them in your glove box, but they're there and they're handy, and that way, you don't need to dwell on them, but you have it available and at your fingertips should the need arise. So we really wanted to make sure that if people started talking or if people needed help, they had the resources available to help them. So I also want to just touch on some of the other resources that are available. NAMI, the National Alliance on Mental Illness, has phenomenal resources free and available for you to use on their website. Everything from flyers about the various mental illnesses and conditions and warning signs, to resources for classes and support groups and information about policy and legislation changes that they're working on. Again, makeitokay.org is a website that's available and free for anyone to use, and is a great resource for people to start talking about mental illness and get some tools for that. NorthlandHealthyMinds.org is our website where we have created a community events calendar to try and promote the mental health activities that are going on in our area. Let'sTalkMinnesota.org is an organization that was created to really let people know about the crisis line, and then I apologize. And they've done focused resource information and advertising throughout the region, and are working more specifically in northeastern Minnesota on providing information about the crisis line. I know I've kind of dumped a whole lot of information on you in a short amount of time, but really there are just a couple of key things that I want you to take away from this. One, Make It Okay is a great resource. It's free, available for anyone to use. I highly recommend it. You can use it in your churches, your schools, offices, or just for your personal use. There's some great tools available there. And the second thing is you don't need to be a mental health professional to make a difference when it comes to stigma. Truly addressing stigma is all about just being decent human beings, talking to someone with a mental illness the same way you would someone with any other medical condition. Show compassion, be kind, and remember that we encounter stigma every day and we can do something about it. So before we close off, we have a couple of questions. Fantastic. I was going to say, I was just going to ask, are there any questions? Question in the chat is, what suggestions do you have for addressing hospital employee attitudes towards a patient with mental illness? Boy, that's a tough one. One of the ways that we do it is really truly by modeling the behavior, by showing compassion, and the other thing that I would suggest is, think about implementing or suggesting to people that that they check out the Make It Okay website. They do have, some handy tips out there to use, as well as, self-stigma checks. And I guess from my perspective, because I've been, dealing with this and talking about this so frequently, is just to approach the person and talk to them about, what's going on with them and in their interactions with this particular person. Is there, they may have their own situation that they're dealing with, or their own mental health issues or situations that they need to address. So I would have an open conversation with them. Ask them what might be impacting their interaction with this person. Are there any other questions?
Remember, you can press *2 to unmute your line.
The other thing I would say is, this serves as, a starting point for people to be thinking about how to think outside the box with how you reach a community and how you educate a community about mental illness. There are a lot of things that we can do. Some of the things that I'm excited about that are coming up in the coming year for Northland Healthy Minds is we're planning a gallery hop featuring artists who are focused on mental illness-related artwork, and we're looking at a film series, and we're bringing mental health first aid to a variety of organizations and locations. And that's really another outstanding thing that I recommend people start thinking about in their organizations, is to implement mental health first aid right alongside of their CPR and first aid classes that we offer to employees and to organizations so often. We should be offering mental health first aid right alongside that because it is such an important skill to have in order to be able to deal with people who are in crisis or who might be experiencing a mental health crisis. Do we have any other questions on the line? No? Well, again, I want to thank you all for being here today, and thank you for listening. Certainly, if you have additional questions or want to reach out to me, you can reach me through the Northland Healthy Minds website. There's a link on there for our email to contact us. Again, I appreciate your help and your willingness to work on this issue. And just remember, it really all comes down to recognizing people's humanity and being kind to them.
Thank you, Shannon, for a great webinar. The recording, along with these slides, will also be